The pharmacy chain will announce that they will move 120,000 employees into private healthcare exchanges, similar to those that will be mandated by Obamacare. Dan, what kind of changes can employees actually expect here?
I think relatively big ones, but also relatively small ones. First of all, this has nothing to do with Obamacare. These private health exchanges have existed for years, and they are running around trying to go to giant employers like Walgreens and say, look, you have an issue. It's a real pain to deal with insurance. There are 50 different plans. The cost just keeps going up. What you could do is just say to your employees, we're going to spend $10,000 a year on your health benefits, but you go to the trouble of finding which plan you want. Maybe, you're young, you don't have a family, you're more into taking risks, so you want a low deductible plan, or you're someone who's more fearful and has pre-existing and chronic conditions in your family, and so you may want a more expansive plan. What they're effectively saying is, this is the amount we will contribute.
Yeah.
You go and find the plan that works for you, and it's a way of them not only capping their costs, but sort of removing the headache of a lot of people in the HR department.
So, Dan, as you know, Walgreens isn't the first big company to make this kind of move. Do you think we're going to see more private corporations set up similar exchanges?
I think so. In the past, there's been this sort of long development where companies started providing health care benefits to employees. Part of it was to ward off unions. Part of it was because paternalism. Part of it was because of regulations. But it got to a point where employers felt like this is something you had to give people as you were employing them. It was part of their compensation. It was part of what they needed to work, like a phone or a computer or anything else. And what we've seen on the one hand is a lot of companies saying, you know what, we can't afford to provide health care, so we're not going to do it at all. Mm-hmm. And another subset saying, we want to keep providing it, but we don't want to deal with all the cost and expense, so we'll do these exchanges. And then you will still have, I think, the elite employers and white-collar firms, investment banks, accounting firms, sports teams, who will regard providing health insurance, paying for it, picking it, as part of the thing that they provide, which makes them an employer of choice. But I think that as we go forward, it's going to be a smaller group of those. They will, companies by and large will be willing to pay for health insurance, but they'll only be willing to pay a certain amount. And of course, the idea is that if you make the employer the consumer, that'll spur more competition. They'll choose more wisely, and that will help kind of moderate the cost of healthcare a little bit.